Hey, David, won't Medicare for all kill jobs? This is a really loaded question, and I'm glad to have the opportunity to talk about it. There's this imagery of killing jobs that is a very political imagery, to be quite honest with you, because the reality is that all the time, governments, federal government, state governments, departments of the government, whoever, all the time decisions are being made that have an economic impact and they have an employment impact. Sometimes we're talking about thousands. We're talking about 1,000 new jobs, but we lose 200, but there's some economic gain or some social gain from that change. So, number one, we've got to get away from this imagery of, quote, killing jobs, because all the time as a country evolves, decisions are made that create jobs and that eliminate jobs. They cause firings, they cause layoffs, they create new industries, etc. What we have to understand is that a lot of those jobs that exist in the medical field right now, which would be unnecessary and thus would disappear under a Medicare for all system, are not jobs that are actually providing for the greater good. What I mean by that is, if you consider medical insurance, health insurance fraud investigators, medical billing and coding experts on the insurance side, medical billing and coding experts on the hospital side. By the way, not all of them would go away under single payer. Under many single payer systems, they remain. All of this bureaucracy plus the profit that is implicit in the system, that doesn't lead to better health outcomes. It doesn't lead to lower costs. It's simply, yes, providing work to the people that are in those jobs. And it is work that is being paid for at the expense of people who are buying, availing themselves of healthcare services. So would some of those things be eliminated if Medicare for all were to be passed? Yeah, some of them would. The economy would have to adjust. In history, this has happened many, many times. I give this example often, and I think it applies here. Think back to the development of the automobile. The automobile was a much more efficient means of transportation than horse and buggy carriages or whatever you call them. There were people who said this is going to eliminate the jobs of the drivers, I don't know what they were called, of the horse buggies. Would that be a reasonable reason not to allow cars to be developed or to prevent the development of automobiles? Of course not. Ultimately, those individuals no longer were in demand in that role of horse buggy drivers. They were reintegrated into the workplace in other ways. Some of them probably suffered long-term unemployment. That's true. But we need to stop falling for this idea that any policy that will result in any job loss is unacceptable. In fact, it's actually a very sort of center-right idea. I mean, there's this infamous video of Milton Friedman arguing with some college kid where the college kid says, shouldn't there have been consequences for some car company that had a car that was dangerous? And Milton Friedman said, okay, well, hold on. So there was a negative consequence from the car, from some kind of negligence. How much should that car company have paid to fix that problem? If the car cost 10 grand and it cost them 10 grand to fix their problem, should they have been forced to do it? What about, should they have paid $100,000 to fix a problem on a $10,000 car? At a certain point, you get to this realization that there are going to be negative consequences to doing the right thing. And whether you're on the Milton Friedman side of that or not, it doesn't actually matter. The point is, every single day, decisions are being made, policy is being affected, where some jobs are lost, there is some economic cost. It has to be accepted. In a country of 340 million people, anytime you make any kind of change, there will be people who gain and people who lose. Right now, the losers are people who can't afford to pay for care, people who get substandard care, people who are going bankrupt because of medical bills, and those who gain are the for-profit insurance companies, the elected officials that perpetuate the status quo in exchange for donations and whatever else. Yes, some jobs won't be necessary under Medicare for all. The net benefit is gigantic, and that or some system like it is still the right thing, even though there will be jobs that will no longer be necessary. And we just have to accept that and not fall for the right-wing talking point that it will kill jobs. And by the way, that is an on the defensive talking point. When the right goes to Medicare for all will kill jobs, They've often already conceded some of the benefits of just such a system in terms of access to care and in reducing cost. That's why they retreat to it. And it is a very, very weak counterpoint to some kind of nonprofit system, the likes of which many countries have already employed. Let me know what you think. We have a great bonus show for you today. Become a member or a patron to get instant access at www.joinpakman.com or at patreon.com/David Pakman Show.